charge of the healthcare sector, part of the KCPA plan. But really Katie's actually in charge, but she knows more what's going on than I do all the time. But yeah, we've got several different sectors. So I don't know if you've had a chance yourself to kind of look through the KCPA plan and all the different sectors. So there's plenty of different areas for anyone you know, especially if you got some coworkers or people you're volunteering with and stuff who want to get involved in a different way. It doesn't have to be in the healthcare sector part. So like Boys and Girls Club, community organizations, stuff like that. We've got different places kind of for everybody to pitch in and give ideas where they can. But the healthcare sector, our main focus is the strategies. And we're going to go over those kind of through the meeting a little bit. But that's kind of how each sector is broken out into certain strategies. And then, so we've got the sector group, and then in those strategies, we try to produce some implementation groups. So trying to focus on like little projects and stuff within those groups to attack those different strategies and improve physical activity. So that is kind of our mission and our goal with the whole group. So
now, how long has this KCPA been around?
3 years now total. 3 to 4
20,
I think.
Since 2018 is when we first started the initiative. Got
So,
you.
there we go. That's why Katie's in charge.
Right.
Yeah, there was all sorts of data collected and stuff. It's kind of modeled on the National Physical Activity Plan, where they're finding just getting data and figuring out, you know, kids, adults, everybody, what kind of physical activity was going around in the country, and where we had barriers and where we had deficits and all that kind of stuff. And so I guess probably started collecting the data then there in 2018 and had a report, and that's also on the website with some grades on different things, and they were all pretty bad grades. The only one that had a decent grade was sports, and that was because the question was basically, do kids play any sport all year long? So if they answered yes to anything, it was a positive. So we ended up getting a B on that. But everything else was kind of C's and below. Yeah, so that's kind of how that went. But yeah, let me Ed, Katie, you guys want to introduce yourselves to Darian, and then we can maybe go through those strategies that we got up here.
Or Katie, go ahead, please.
Oh, okay, absolutely. So Darian, nice of you to join us. Actually, I met with Julie and Waymond, and so very aware of Boys and Girls Club and what they do and their relationship with St. Luke's. So I'm glad you could join us. I work for the Kansas City Healthy Lifestyles Collaborative, and what I do is I support some of our different initiatives. One is the KCPA plan. So as Jay mentioned, we have 10 societal sectors. I think he did. I was trying to also find links for you. So we have 10 sectors, and I help support 5 of those groups as part of the KCPA plan. So thank you for joining us today. And I'll go ahead and give it over to Ed.
Thank you, Katie. Darian, great to meet you. I'm Ed Kramer. I'm a family doctor trying to retire. And I've set a date, you guys. It's even in print now. It's been published at least a year, 2026. So
okay,
2 more years of doing what I'm doing, which is primarily teaching at UMKC School of Medicine, UMKC Physician Assistant PA program, and working a little bit out at University Health Lakewood. And then I supervise patient care only at one place about once a month, and that's the Sojourner student-run free clinic through UMKC School of Medicine at Linwood United Church at 31st and Olive. Anyway, so that's a little bit about my background. I've always been interested in health promotion, obviously, as a family doctor. Healthy lifestyles just fits right into all of that. So, and I was glad to see kind of what I view from my perspective as an evolution or an expansion maybe of the KC Physical Activity Plan, which I was really excited about, and then into a broader Healthy Lifestyles Collaborative, which I'm super excited about. So glad to have you involved.
Sweet. Well, it's nice to meet all of you. And so, kind of, I guess, since I'm the only odd man out here, what was the intention of today's meeting, and just the goal of getting different folks from the health sector involved?
Yeah, I mean, our goal, so it's basically every other month we have a healthcare sector meeting, and then in the month in between we do the implementation group. So the smaller group meetings is kind of the current setup. The goal of each healthcare sector meeting each month is basically just get everybody involved in the healthcare sector group, which usually we have a little better attendance than this. It's been kind of waxing and waning over the years, but sometimes we'll have like 20 people on the call, sometimes 4 or 5. But it's more of an update and see if anybody has any new ideas, new strategies, anything that we can bump out to the smaller implementation groups. We also have, for each sector, we have money to do some projects. So projects that require fairly nominal amount of money. I think it's per year it's $6,000 per sector. So that can be broken up into 12 $500 projects, or one $5,000 project, and one $1,000 project. So it just kind of depends on what the group decides. But there is some money involved in ways to spend it and help start a program, or bridge a program if they're in between grants or something like that. There's opportunities there. So this is kind of an update, and just the whole idea of the whole entire program is that it's collaborative. The whole KCPA plan, we want all different organizations to feel free to give ideas and join in and be a part of it, and get people from different organizations together, because there's plenty of times where you don't really need to reinvent the wheel if you got an idea, if somebody in another place has done it 8 times already. So yeah, that's kind of the point of the whole thing.
Okay, cool.
Yeah. So usually what we do is we go through our strategies, and healthcare sector, we have let me remember, we have 4 strategies that we have come up with. And I don't know, I guess I could just share the agenda, and then can I do that? I haven't done that on Zoom yet. Share, let me see what I got. Share that. You guys
I
can
also
see.
mentioned.
Yeah, go for it.
So no, thank you. Yeah, we can go ahead and it's a short agenda, because we do know that this time of year a lot of people are busy. So typically our attendance does drop off around this time. There's a lot of conferences going on. I know half of my team is out right now in Atlanta for a CDC REACH grant conference. So that's also a reason for low participation. But like last fall, we were planning our own conference with Dr. Trilk, and I don't know if you want to speak to that, Jay, and how it aligns with our strategy 22, and how we got all of the schools together in the health science district to be a part of this. So, and we can talk about it when we go through our strategies, but just know we do have usually better attendance and representation from like all of the schools in the health science district, at least.
Yeah, UMKC, KU Med, Kansas City University, all 3 have been participating over the years. And but yeah, we'd like, St. Luke's and St. Joe and Advent, we'd love people from all the different healthcare organizations to get involved. I think it's been a little bit easier to get the academic schools involved, because there's people who kind of this kind of thing is part of their job description. But I don't know if some of the more private places that's a little bit harder, but maybe it'd be easier with the partnership with the Barnes Jewish, because that is an academic center. I don't know, maybe you won't be the last St. Luke's person to jump on board. But yeah, we'll just go ahead and go through our strategies, so you guys can see that agenda. Did I share that correctly? Okay.
Yes. Yes.
So, yeah, so strategy 19. So we kind of started at 19 because we just labeled the strategies starting with the first sector, and healthcare sector is the eighth sector or sixth sector that we came up with. So we start with 19 for us. But and each sector has probably about 4 or 5 strategies each. So healthcare. So the first one was healthcare systems should partner with other sectors to promote access to evidence-based physical activity related services and to reduce health disparities. And we came up with these strategies at a big meeting about 3 years ago. I think that was when we really got all the strategies done. Maybe it was 4 years ago now. I can't remember. But the whole thing's been on Zoom basically the entire time, which has been a little frustrating. Obviously during COVID, we really had to do it that way, but it does feel like you get maybe a little more buy-in and a little more collaboration in person, but also everybody's busy and everybody's at various different organizations. So getting everybody together every other month in person is probably not very feasible either. So Zoom works, but yeah, we came up with this strategy. And one of the implementation things that we came up with for that was this Just Walk, or sometimes called Walk with the Doc, and trying to just get people moving, like one Saturday a month, 1 or 2 different locations, maybe one in Missouri, one in Kansas, and that's how we started off. And it's been a little bit of a struggle because we've kind of come at it from a pediatric standpoint, because this was kind of championed by one of our Children's Mercy physicians. She was the physician champion on this. So we came to it from a children's standpoint. And I don't think a lot of people are trying to get their kids to just go out and walk, but I think it works really well for adults, because I think UMKC has had some real success with this. And it'd probably be something that maybe at some of the primary care clinics at St. Luke's, putting out some word there for some of the UMKC walks might work better. But that's one of the things we're trying to figure out on this Just Walk plan is, do we need to just kind of scrap it as a children's program and just really partner with KU and UMKC where they're already doing it, since they seem to have some good attendance there. So those are some of the things we're still working on that. And Katie's been our champion for the Just Walk now for basically the last year and a half. And she knows a lot more about it. So I'm going to let her talk a little bit about it right now.
Yeah, so I'll start with our current walks, and then Jay, I actually have an update from KU I got this morning. So yeah,
Awesome.
I emailed them December of last year, so it's been a minute, but we finally head back. So yeah, right now, as Jay mentioned, we've had some trouble with organizing volunteers, are getting participation from community members, and we've been at a few different locations. So like our Kansas side, we've been at Pearson Park, and then we switched over to Mill Creek Streamway Park because we work with Johnson County Parks and Rec, and we thought it'd be a good opportunity. And plus it has high foot traffic. Unfortunately, we saw the same kind of issue as we did Pearson Park. Not many people want to join on a walk, or be up early enough on a Saturday to walk or bring their children. So at the moment, we are kind of on a pause in our Kansas location while we continue to brainstorm how we can partner with other Just Walk groups or potentially change our park. And then on our Missouri side, we started that last year. We had an okay turnout. We actually partnered with Harris Park. And we were targeting parents who were waiting for their children to get done with golf programs. It was okay, but when we went back to kind of survey the community, they weren't interested. So we've been tossing around whether or not we'll continue walks there, or our recent program director of the Kansas City Healthy Lifestyles Collaborative actually just changed positions, and they're now the director of employee wellness. And they're thinking about taking it over and starting a walk actually in the health science district at Hospital Hill. So that's kind of where we're at with our walks. They're kind of postponed until, as Jay mentioned, we can find kind of more of a actual healthcare lead to champion these walks. And And then in relation to the other Just Walk programs in the Kansas, Missouri side, we do work closely with UMKC, and they host their walks. I always forget this community center, and I may not have it on here. Jay, do you remember where Stephanie hosts her walks? It's East something Community Center.
No, I do not.
Okay.
But
Well,
she
I do
does,
know-
and it's successful. I do know
Yeah,
that.
it's successful. So they partner with AARP. And so their walks have been going great. We've had some trouble reaching out or connecting with KU, but I did just hear back this morning. So they're running into a similar problem we are. They haven't had much luck. But what they also recently did, so it was previously led by a pharmacist and a therapist, and they said that this was prior to COVID and they did well, but since returning to normal activities within the last couple of years, they switched their Just Walk program to a student-led organization. And they have had some trouble recruiting volunteers and participation at their walks. So, and they do their walks at Loose Park. But that's all I have for updates. So that's Just Walk. It's been shown in other organizations to be very beneficial. I guess we're just having some trouble over on the Kansas and Missouri side locally. So
Yeah, and it's the idea is kind of, you go out, you get a little 5-10 minute talk by a healthcare professional about physical activity or nutrition or something, and then you go walk for half an hour, 45 minutes as a group, and just kind of get some simple aerobic activity, get people moving, trying to change some lifestyle habits, because the hardest part about doing any of that is getting started. So if we can get people out there for one Saturday, maybe they'll do it the next couple Saturdays on their own and then meet back up a month later. So yeah. And then but we have shown, like Stephanie Ellison has shown that it does work. I think you just got to get the information of the right people, and I think something like that at St. Luke's and the other healthcare organizations around town, especially in the primary care clinic, with some doctors being able to promote it and say, hey, this is a good place for you to start, I think is potentially a good way to get people going.
For sure. We have a lot of the same issues, on the St. Luke's side and Boys and Girls Club, just that engagement and participation. We can have all the greatest resources and programs in the world to take advantage of, but if you don't have that relationship or that rapport with that community, then it's really worth nothing in the end. And so I'm working on trying to set up something similar with the Boys and Girls Club, where I'm not sure how familiar you guys are with Boys and Girls Club, but it's one of the largest youth serving organizations here in KC. We've got 11 different sites across the metro. And our biggest driver by far participation is our sports programs. And so currently we're doing it's baseball season, and we have well over 1,000 kids who are signed up. And so what I try and do within my role is use opportunities like that where folks are already present and engaged in some activity to then bring in that resource and make it as convenient and accessible as possible. So like for right now, baseball practice, we have probably 40 or 50 parents at least who show up, any given night of the week. And, maybe 20% are super locked into practice, but then you also have another group of people who are maybe off walking by themselves, already getting their steps in, or just kind of hanging out. And so I'm definitely looking at how to explore bringing something like this to our practices to, two birds with one stone.
Yeah. No, that'd be perfect. That might be a great opportunity to put that Just Walk program at something like that, because that's
sure.
really where we're trying to get. We're trying to get where people already are and then get them moving. Yeah.
It's like you said, it's hard to get folks to wake up early on a Saturday when they've been working all week doing whatever, to come out and walk with a bunch of random people you've never met before. And so if you can show up and meet them where they're at and make it a little more accessible or a little bit more convenient, then I'm sure we'll see a better result. And then also, I wonder too, is there ever an incentive for participation up to this point?
We've had a few little tchotchke kind of giveaway stuff. Haven't we? Brought some children's rooms, like keychains and water bottles and stuff before, but
yeah, and we have Just Walk t-shirts. We actually one of the funding opportunities we had, Jay mentioned at the beginning that each of our sectors have funding. We wrote for incentives, so we have funding available for incentives. We just haven't identified what we want to purchase. So we have an opportunity once we're able to kind of like pinpoint where we're going to continue these walks and kind of figure out who our target population is. We do have the opportunity for, yeah.
Okay, that makes sense. So that brings me to another question. You know, as far as what we've done up to this point with the Just Walk, like what's decided, you know, where you've gone to do those events? Is there a certain community you're trying to hit and get involved in? What does that strategic process look like?
I think we started with Pearson Park because we recognized Kansas City, Kansas as an underserved population, where there were healthcare issues, you know, obesity, diabetes, those kind of things, that exercise would benefit, and people who just didn't have necessarily resources to go, you know, like the 800 gyms there are in Johnson County,
Right.
things like that. So getting people started there and tried to meet people kind of where they were at, where it wouldn't take a lot of transportation to get there.
Mhm.
Ideas, you know, maybe things that were on bus routes and things like that. So that's kind of where we started first. Tried to get the local churches, and there's like several schools. Just Pearson Park's right next to Turner High School and Turner Middle School and Turner Elementary. Like it's all within walking distance of it. There's a couple churches right there. So that was kind of our initial thought, and that I think we got, you know, maybe 4 or 5 people at the first one, and then it slowly dwindled, and then we got a lot of just no one showed up at all, even with giving that information to the local groups and putting it out in the high school and the middle school and
Right.
that kind of stuff. So
Okay, that makes sense.
You guys have a couple of thoughts. This is a great conversation. One is when I hear about Kansas City, Kansas, and I spend very little time over there, just by geography, probably more than anything else. But I have met Dr. Sandra Stites, who is the executive director, maybe CEO of Vibrant Health, I'm guessing that Jay and Katie know, and maybe Darian does. Anyway, they've got a great, federally qualified health centers, I should say. I think they've got multiple locations. So if they have not been involved, they may be interested. They certainly would have some clientele to reach out to, who would probably appreciate
Yeah.
opportunities like this.
I think they're the ones who took over Children's Mercy West, I believe, when that shut down. I think that's right.
Probably, yeah, probably. I know they also have you know, some KU connections, at least in terms of their women's health. So that's one thought. The other thought is, I've gotten to know a Dr. Larry Gibbs in Lee Summit. He and I both serve on the board of directors of the Kansas City Academy of Family Physicians. Larry is the program director of the relatively new family medicine residency program, which is in Lee Summit. It's I think it's titled HCA Family Medicine, although you might also see Lee Summit Medical Center affiliation there, because that's where they're located. So anyway, talking to him recently at one of those meetings, he just happened to mention that they're starting a Walk with a Doc program. So I don't know if that name sounds familiar, or if he's doing it through this group or some other group, but I'm certain that I have shared the Healthy Lifestyle Collaborative information with our board. So Katie and Jay, does that name sound familiar at all? Larry Gibbs.
I have not met him, but yeah, Barry Gibb, I know that one, but
yes, that was before my time, Jay. But
yeah. So yeah, I mean, I think it makes a lot of sense for us to combine with people who have already gotten it started and have some participation, because if we can just add to that participation, that would be ideal, or add more docs or pharmacists or physical therapists, whoever, you know, wants to be involved. And that's why we changed the name from we started off walk with a doc, but then we made it just walk so that, basically any healthcare professional or volunteer could participate. And it didn't just have to be relying on the doctors to show up. So,
All right. So the ideal situation would be that some other organization would step in to be the head of this program, and then the KCA or KCPA team would just supplement and help out, bolster that effort in whatever way they could. Is that kind of the idea here?
yeah, I mean, we're looking for a champion. So whoever's excited about this and has some, time to kind of be the driver, the person who helps recruit and can volunteer a little bit of time on Saturday. It doesn't have to be Saturday. I mean, I think the Missouri side, we did a couple at Harris Park on Wednesday afternoons or Tuesday afternoons or something. So yeah, the Saturday was just kind of when we knew we could get people away from work, but that might be the worst time to do it. Honestly, I don't know. I don't know what if people got ideas, we are open to changing it up and making it work a
Okay,
better
so
way.
I guess to clarify on my end, so hypothetically, right? Say St. Luke's, I took this over or champion this strategy. Excuse me. And we start implementing this at Boys and Girls Club during baseball practices. What would this group's involvement look like at that point?
Yeah, I mean, we would be able to help out. We've got the funding for it. So one of the things that Just Walk requires, I don't know, Katie knows the numbers, but it is a fee each year to be a part of it.
250. And then it's
So that's
yeah. So there's a renewal fee, and then if we started like a new program, so essentially what would happen, sorry, Jay, do you mind if I take over?
go for it.
So
Way
essentially
more
what
than
would
I do.
happen is that if St. Luke's were to champion, we could transfer our current location over to you and help support you. So this way you wouldn't have to start a new actual license. So essentially the whole thing covers like insurance in case somebody were to get hurt. It covers one specific location. In this case, I guess that would be the tricky part. You'd only have to be able to pick one Boys and Girls Club location to start this off at. But our support would look like I create flyers and help with communication, so get it out to our other partnering organizations. So within the KCPA plan, we have like over 100 different organizations that participate in different sectors of the KCPA plan. So we would be able to distribute information to them about your walks. We also do have social media channels. We recently started our physical activity campaign, which is Move Together KC. We would be able to share information on that platform. As Jay mentioned, we do have funding, so we'd be able to help with incentives. But that would pretty much be what it would look like within our efforts.
Okay, cool. That makes sense. Thanks, Katie.
Yeah, absolutely.
Yeah, so give it a thought. I know we don't have a ton of time left, and I got a meeting at noon too. So I just want to make sure we get through all the strategies so Darian has an idea of what we're doing here, and then so I also have an idea of what we're doing on all of them. But strategy number 2 there, or not 2, strategy number 20, number 2 for the healthcare sector. Healthcare systems should increase the priority of physical activity assessment, advice, and promotion. And that's one we haven't done a whole lot on. It's probably the one that's gotten kind of thrown by the wayside so far. But one of the big things for that early on that we were thinking is making sure the physical activity vital sign is an important thing that is done at primary care visits as part of the electronic medical record, things like that. That was kind of our initial thoughts. And since no one in the group necessarily had real agency over changing those electronic medical records, we didn't pursue that one super hard at the beginning. But I think that's one we gotta probably jump up there now that we've done a little bit better job of implementing some of the other strategies. But
what does that I'm sorry. Quick question.
Yeah.
What does that assessment piece look like within the clinical setting? Like, how would you assess someone's physical activity?
Yeah, so the physical activity vital sign is something that's pretty well established. The AMSSM and ACSM, the national kind of sports medicine organizations, have really been focused on physical activity as medicine. So exercise is medicine is the actual name of the program, and they've created this physical activity vital sign. Basically, you get I'm blanking on the acronym for it. TIF, time, intensity, frequency, and I forget what the other F is. But that way you can just, so it's just something that on check-in, you know, the nurse just says, hey, how in the last week, how often did you do at least moderate physical activity? And basically we're just trying to figure out if it meets the physical activity guidelines, which is basically 30 minutes a day for everybody, with over age 50, recommending at least 2 days a week of strength training, although I think that should be for everybody, but the official thing says over age 50. And then for kids, it's a little bit different. It's basically just, you know, almost an hour a day is what they're recommended at this point. But just kind of going through those and just making it part of the medical record, making it something that at least gets a question each time, so that patients are thinking about it, so that physicians can address it. So so putting that in the medical record, and then being able to recommend that physicians, nurse practitioners, kind of that primary care setting, that they can feel comfortable writing an exercise prescription, or maybe have something already, you know, set up. So trying to make it easier on the provider too, because you know, that there's only so much time in a visit, and talking about diabetes and obesity and really addressing the like acute conditions of those, you might not really have time to address the physical activity part, which is, we know, something that will help those in the long run.
Right.
So that's I think where strategy 20 we need to you know, get some resources, or get some education, or just you know, be advocates for it. But how the best way to do that is, that's one of those, you know, brainstorming. We want help from everybody, ideas from everybody in the group as to how to improve some of that in all the different healthcare organizations around the city. So I think, I mean, part of it's education, part of it's helping people figure out how to make it easy, so it doesn't, you know, get in the way of their time doing all the other things you got to do at a visit. So that seems to be the barrier that we've heard from people. But I think that goes nicely with actually strategy 22, which is really the university's postgraduate training programs, medical schools, professional societies, pharmacy schools, athletic trainer, physical therapy, nurse practitioner, PA, all that kind of stuff, kind of changing the curriculum at the entry level education for all the medical professionals. And that we actually made, I think, some pretty darn good progress last year on, when we brought Jennifer Trilk, who's at the University of South Carolina School of Medicine, who's nationally known. She's been on the Presidential Fitness Council, all that kind of stuff. She is pretty awesome, but she started basically a lifestyle medicine program at that medical school. She came and talked to us, and then she went around to, she did a grand rounds at Children's Mercy on it, and then we had her be able to visit with the 3 medical schools in town and kind of give ideas on how each one of them can implement some changes in their curriculum. And at least KU and UMKC are in the process of doing that, and have even kind of started a few changes right off the bat with some lectures, and KU is actually kind of revamping their entire curriculum here. And they let us know that the lifestyle medicine part is going to be a really big piece of that. So that's pretty huge, but we definitely want to keep pushing that, so it trickles down to the pharmacy school and the nurse practitioner school and the PA programs and all those kind of things. So that, I think those 2 strategies, 22 and 20, really go together. But I think 20 is more on the people who are already the healthcare professionals, the people who have finished school and they're already in practice. So that's a little bit of the difference between those 2 projects. And then 21, the healthcare providers and professionals. recognize that physical inactivity and insufficient physical activity are treatable and preventable conditions with profound health and cost implications. So that one, we actually started a billing and coding implementation group for that, so that it's something that could actually be reimbursed and stuff. And that has been a little bit more difficult. Dave White, one of our sports or exercise physiologists, I should say, at Children's Mercy, was in charge of that. And there's a lot of barriers with the billing and coding, and especially within Children's Mercy. We tend to be a really conservative organization about billing and coding. So no one was really willing to change up how things were reimbursed within the exercise physiology group. And it is hard to bill and code for specifically physical activity education. You can bill for time, but specifically for physical activity education, I think that's been something we found to be difficult. And I don't know, Ed, you know, in your personal experience, if you've ever really even tried to bill specifically for that kind of education. I don't, because usually what I'm doing in sports medicine is actually trying to get kids to slow down because they're overdoing it. So it's a little bit different than the primary care setting. But yeah,
I have not had any specific experience with that. You mentioned time. I mean, that's time for the overall visit, probably. If you know, if this brings you into another level of how long it took you to have that visit, a clinician may be able to use that billing approach. It's been a while since I've even entered any PPT or charge codes, so not the most current on that.
Yeah, and that's for us too. I mean, somebody else actually truly enters our billing, and it's not us in charge of it anymore at Children's Mercy either. So those are kind of what we're really working on with each one of those strategies, but trying to educate people in physical activity who then educate the patients, and then making sure that with that education piece, they also get reimbursed for what they're doing, or otherwise people might not spend a whole lot of time with that physical activity education. So those are kind of where all the different strategies are at. So yeah, that's kind of just a quick overview of the healthcare sector.
Jay, I know I've seen these priorities before, but I'm noticing now, are they all physical activity? They all seem to be physical activity oriented. Where's the rest of the healthy lifestyles?
Yeah. So, I mean, the KCPA plan is really, all the strategies came out of physical activity. The lifestyle medicine part of it kind of came because Jennifer Trilk did, when she came to talk, she wasn't just going to talk about physical activity. She was going to talk about the 6 pillars of lifestyle medicine, which is physical activity is one, healthy eating is one, mental health. There's social interaction, sleep, one of them, and the 5th one is, I don't remember. 6th one is,
That was pretty good though.
but yeah, I feel like Shelly and I never remember the 6th one. But those are kind of the pillars of lifestyle medicine, and I think when the medical schools are going over their curriculum, they're really looking at those 6 pillars of lifestyle medicine. It is an established kind of specialty. They've got a certification. It's not I don't know if it's a true board certification yet, but they've got a certification for people to get. So they're definitely trying to implement all those different. Substance abuse, is that the 6th one? Did I say that? I think substance abuse is the 6th one. Yeah, so our strategies are really focused on the physical activity part, but that's because it's part of the KCPA.
And
So, oh, go ahead.
oh, I was going to say, a lot of our sector groups are specifically focused on physical activity, as Jay mentioned, because it's modeled after the national plan. However, a lot of our groups are starting to adapt some of these strategies to include other healthy lifestyle behaviors, such as our sports sector group. They're focused on how physical activity or sport participation relates with mental health. So we are starting to expand our efforts. It's just not included within our current strategies and tactics.
And we can always
Okay.
change up. Well, I think we can change up these strategies, especially if the group feels strongly that we should add something to it, or we could have a 22B or 22C or something like that. I'm sure
Absolutely.
it's
Well, I think
malleable.
if with the title of Healthy Lifestyles Collaborative, I think we're at some point obligated to, treat some of the other healthy lifestyle pillars, if you will, directly, as opposed to what's being done, which is really good, including lifestyle medicine and medical education in various places. But anyway, I'd like to see it expanded. I mean, it's huge. It takes a huge job, makes it huger, and so that's pretty challenging. I do have the 6 pillars from the lifestyle medicine that I just Googled. So I'll share that in the chat. And also, just real quickly, it's number 1 is nutrition, number 2, physical activity, number 3, stress management, number 4, avoidance of risky substances. So that's habits. Number 5, restorative sleep, and number 6, social connection.
I was close.
You were really close. We're going to give you that one, and I'll give it just all 6 of them to you in the chat.
Well, I appreciate y'all bringing me up to speed. I for sure, just off the bat, this aligns so much with not only what I'm doing at St. Luke's, but also with the Boys and Girls Club. And I think actually this Friday, Katie, or sometime early next week, I believe, I'll be catching up with Wayman and Jill, or Juliet, I'm sorry, to recap what you guys have talked about. But I think there's a lot of opportunity here for us to collaborate. And I'm also going to take this to I'm technically a part of the population health team at St. Luke's, and a lot of the work that we're doing right now is all about, having the same upstream approach to try and get ahead of the ball and not wait until you're having all these acute issues. Now we're putting band-aids over problems, and instead of trying to really educate and empower people to make better decisions and ultimately live, a better life, a longer life, a healthier life. And so, super grateful for, I guess, just being on here today and to meet you guys. I'm super excited about what's in store.
Yeah, thank you for joining us. I'm happy you're on the team.
Yeah. Thank you, Darren.
Absolutely.
Yeah, great to meet you. I'm also following up. I'm going to send you those strategies, and maybe we can coordinate a meeting to discuss more about Just Walk.
Cool. Sounds good to me.
Awesome.
All right.
All right. Well, good to meet
Yeah,
you all. You all take care. Oh, go ahead, Jay.
Yeah,
Let me cut you off.
Oh, I was just gonna say, if unless anybody's got any big new ideas, I think we can give everybody 10-15 minutes back. So
Yeah. Jay, would you mind staying
Cool.
on for just like 3 minutes?
yeah,
Okay,
for
awesome.
sure.
I'll stop the
All right.
recording.
Y'all take care.
Bye.
All right, nice to
Good
meet
to see
you.
you, Darian.